Hello everyone, this is the voice behind Medicos NP. Today we are going to study botulism. Hope you like it. Botulism. Simply, botulism is a food poisoning, but it is caused by bacteria on any preserved food, especially meat. Firstly, let's know the history of botulism. It was firstly discovered in 1793 Germany and it was caused by sausage. And to make you a little interested, the word botulism has derived from the Latin word botulus, which means sausage. Later, in 1895, it was isolated. It was weaponized by several nations including US, Japan and Soviet Union, beginning in 1930s. In 1980s, Iraq produced 19,000 of concentrated botulism toxins. As I have mentioned earlier that it is caused by bacteria, so I want to let you know that the name of the bacteria is Clostridium botulinum. So let's go to the morphology of it. It is large, gram-positive and strictly aerobic bacillus that forms subliminal spore. It is very toxic in nature as less than 1 gram of it is lethal for a human. Recently, the type A and B toxin has been approved by FDA for cosmetic and therapeutic purposes. Actually, botulism is a rare disease occurs naturally as 4 syndromes. Foodborne illness due to ingestion of toxins. Wound infection due to wound colonization by toxinogenic Clostridia with in situ toxin production. Infant botulism due to colonization of infant intestine by the toxinogenic Clostridia with in situ toxin production. And adult intestinal toxemia, a rare form of colonization with similarity to infant botulism. Now, before telling you the pathogenesis, I would like to tell you the normal mechanism of the body. So basically, this is the nerve terminal and the synaptic vesicles are already ready with its neurotransmitter. So we can see that there is the presence of snare protein. So this snare protein present at the terminal fuses with the synaptic protein, forms a complex with the synaptic protein which is synaptic fusion complex, and the synaptic vesicles fuses with the nerve terminal and which results in the exocytosis of the neurotransmitter, which is mostly the acetylcholine. So this was the basic mechanism of the body. Now let's know what happens to the process when a person is infected with this bacteria. Okay, so basically it has a heavy chain and a light chain. The heavy chain binds to the nerve terminal. Then, after the binding of it, the internalization occurs. So, after the internalization, it translocates to the cytosol. After it reaches to the cytosol, the light chain cleaves one of the several proteins are involved in the release of neurotransmitter, which results in the inhibition of release of acetylcholine. Now let's see the same scenario in a pictured form. So, as we can see that the toxins as endocytosed in the vesicles through the heavy chain. Now the light chain of the bacteria will cleave the various protein as I said earlier. So the toxins has been divided from type A to type G. So the different toxins will attack different type of proteins. As you can see that the protein of synaptic vesicles, the snare proteins, and as we can see that proteins are destroyed, then the complex cannot be formed. And if the complex do not form, the fusion of the synaptic vesicles do not occur. So basically, which results, will not result in the release of acetylcholine. Coming to the clinical features, mostly flaccid paralysis is seen. There are different clinical features seen from the different parts of the body, like in GI or urinary, nausea, vomiting, diarrhea, abdominal pain, intestinal illness, and urinary retention can be seen. And neurologically, dry mouth, blurry vision, diplopia, dilated pupils, and dysphagia can be seen. Gag reflex as well. So, muscle weakness, respiratory muscle paralysis, fatigue, dyspnea can also be seen. And it can also cause cardiac or respiratory arrest just because it causes flaccid paralysis. Now, coming to the diagnosis, food history from the past 3 to 5 days of the patient should be taken. The serum, gastric secretions, stool, and food samples should also be collected for the demonstration of toxin. The most sensitive means of toxin detection in this bacteria is mouse bioassay. We inject the sample in the mice, whether it is serum or food samples. So we follow for the development of the symptoms in it. The toxin type may be determined by injecting infected mice with the type-specific botulism antitoxin. Now, coming to the treatment, a quine antitoxin can be used. It is a bivalent and trivalent antitoxin. The trivalent antitoxin neutralizes type A, B, and E botulism toxins. It is effective in the treatment of foodborne, intestinal, and wound botulism. It is effective for the inhalation botulism, as the botulism can be transmitted through inhalation as well, but it has not been proven. It does not reverse the current paralysis, but it may limit the progression and prevent nerve damage if administered early. This vaccine protects from the toxin type A and E. It provides long-lasting immunity. The onset of the vaccine is too slow to be effective if given post-exposure prophylaxis. So, this vaccine should be given, that is, before coming in contact with these bacteria. So, this much for the video. I hope you like it, and if you do, subscribe to the channel and like the video.